The University of Cincinnati Gardner Neuroscience Institute started back in 1999 with an investment of $1 million a year to bring together a diverse group of physicians from different specialties who could work together to develop a comprehensive neuroscience institute. And we had 5 centers initially that we thought met our criteria for excellence in research and clinical care and education. Now we have 13 centers and 3 programs, 125 physicians from 15 different specialties working together with the patient as the center. We need to work with the patients and partner with the patients to learn.
The Epilepsy Foundation started a project called the Epilepsy Learning Health System, which was a group of epilepsy centers across the country that were engaging in methods to improve patient care and improve patient outcomes in those individuals we see with epilepsy. The initial efforts were focusing on getting important patient information in a format that we could use for analysis and data management. We didn't want to go and manually review, our 5,000 patient charts that we see each year, which was really a challenge. So we assembled a group of individuals that are involved in epilepsy care, the providers, the physicians, our medical assistants, our epilepsy clinic nurses. We also had individuals from the community. That's something in the learning health system we call co-production, where we are learning from our patients as we develop these system changes. So we gathered that group together and came up with a long-term plan for where we want to see our epilepsy center heading. We've been able to successfully get all that data into a format that we can extract from the electronic health record. We're developing with the learning health system patient and family interaction, patient and family involvement, whether that's tracking their seizures and making sure they keep a diary of their seizures, they can report back to us how they're doing, or challenges with getting access to medications or taking medications.
The learning health system approach is really implementation science. Typically, it takes about 15 years for basic science to reach the clinic. And what we really want to do is catalyze that. And the learning health system provides a structure where you take good practices, identify what your goals and visions are, and you have a systematic plan. We're focused on brain health, and there's a reason why it's not dementia detection. This is the way to help solve the approach avoidance problem that comes with the stigma that's still there about having dementia. We know that 40% of what we can do to prevent dementia is all involving lifestyle changes, monitoring of vascular and other risk factors that are easily within our purview today. We don't have to wait until there is a cure. We're starting with AI in a rather simpler way, which is measuring cognition. We have partnered with a company, Cognitivity, to implement a tool called Cognica. This is a 5-minute screen that doesn't require special expertise for anyone to administer. And in 5 minutes, looking at a tablet, identifying where there's animals or not in photos, we get a very sensitive measure of even compensated early cognitive change. We've piloted with our primary care doctors and geriatricians for tools that can help them. The Cognica screen is one. We've given them Epic-based templates to help guide them through a process when there is a positive screen. We've standardized the processes for diagnosis using spinal fluid and hopefully soon blood-based biomarkers. And we have embedded social workers into their clinics so that they have the same benefits for their patients that we have from our social workers. This gives primary care and all of us, as we journey from our 20s into our 90s, because I am optimistic that we live that long, a chance for us to have some power over what happens to our brains over time.
The Gardner family had a vision along with us of having a patient-centered place for patients who have neurologic problems. Our architectural partners, Parkinson Will, and we as leaders got together, our patients and their families, and we sat them down and say, what is your experience from when you first recognized you have a problem to when you made the call, to when you scheduled an appointment, to you came here? How can we make that the best it can be? You have great office space, which you can fit not just a patient and a physician, but a family along to have a long, big discussion. We also had all the infusion services for medical therapies, a research pharmacy, imaging, a state-of-the-art physical and occupational therapy with a model apartment actually to help patients try out how they can get back into their life after they've had a major neurologic problem. The last 77 years now in neurology, the last 25 years the Institute has been extraordinarily exciting. I feel like I've lived in a golden age where we had almost very few treatments to where we have treatments at every area of neurologic disease that changes people's life. And there's no better feeling than to be part of that. But I think the next 25 years are even going to be better, and we look forward to those.